So at Insight, we're truly driven by the science. So any decisions we make start in the laboratory with our cell studies and then our translational studies, and then are finally driven by the results of our clinical trials.
Well, at Insight, we've had lots of achievements, particularly in the treatment of graft-versus-host disease. We had a phase 3 study that was positive for its primary and secondary endpoint, including event-free survival or failure-free survival. That's the first of any study, phase 3 study, that's been positive for chronic graft-versus-host disease. So that's what we're most proud of, and we'll continue to research this disease and find ways to eliminate it.
It's actually a common complication of an allogeneic blood or marrow transplant. So it's up to 70% of patients who have a transplant from a donor can have some level of graft-versus-host disease.
In 2005, my mom was diagnosed with AML. In 2007, she relapsed and had to have a bone marrow transplant. Just given all of the medications that you have to take following transplant, plus the medications for the graft-versus-host disease, my mom was sometimes on 20 to 30 medications at a time for almost a year following transplant. So keeping track of all of those medications was a daunting task for my parents. So because so much information is thrown at patients during that whole process, it's impossible to absorb because they also have the stress of knowing that their cancer is back and they have to undergo this procedure.
For us, when we support patient advocacy groups, it helps broaden the resources available to those patients so that they can better find what they're looking for and be their own self-advocate. Being able to support Be The Match with the Be The Match app is a great way for us to do that.
So the My Be The Match app will be really helpful for patients with GVHD. One, because it's the practical tool to help them manage their health, track their symptoms, track their medications, but also it provides them a way to connect with the support available both through Be The Match and also in the community of other people who've had and are living with GVHD.
It's very important to Insight to make sure that we help patients with their unmet needs, both in terms of providing new and cutting-edge therapies and in terms of making sure that patients have resources and educations.
The support that we've gotten from Insight, what's been so beneficial for us at Be The Match is that they have this shared vision of a tool to help patients manage their graft-versus-host disease. They've really let us kind of listen to patients and what they are telling us they need and develop that.
Watching my mom go through both a transplant and through GVHD, and watching the strain it put not only on my mom, but our entire family, including my dad as her caregiver, really motivated me to want to make a difference in the lives of patients.
All of us at Insight work to make patients' lives better who are living with cancer, whether it's a chemist, a biologist, or somebody in the administrative offices upstairs. All we want to do is see if we can improve the lives of patients who are living with cancer.